Hi everyone, welcome to topic 2, which is on pharmacokinetics. And pharmacokinetics is all about how our bodies process drugs, regardless of the mode of administration, how our bodies process these drugs and eventually eliminate them from the body. Now, in part 1, we're going to talk about the physical properties of drug distribution and pH partitioning, which might not make any sense at the minute. But first of all, I'm going to take you through a big sort of overview of pharmacokinetics. Now, there are 4 distinct phases of pharmacokinetics. These are absorption, distribution and storage of drug molecules, metabolism, and excretion. And we have this little acronym here, ADME or ADME. And that's what I'm going to talk about on the next slide. So if we pop in our little acronym here with absorption, distribution and storage, metabolism and excretion. Now, when we take these 4 processes, we can kind of divide them into 2 sort of big elements. Firstly, the in phase, which is where, the drug has to get into the blood and then be distributed to targets. And then secondly is the out phase. So the drug has to be converted maybe to inactive drug and then permanently excreted from the body. Okay, so if we start with our in phase, of course, this is going to involve absorption. So movement of drug molecules into the bloodstream, right? Now, there are different ways that we administer drugs. As I mentioned to you, the most common way is in tablet form, where we swallow a drug into the stomach. From there, there's sort of dissolution of those drug molecules, but most of the drug then is absorbed across the gastrointestinal tract wall in the small intestine. Then via the hepatic portal system, those drug molecules are transported to the liver, and then from there to the right side of the heart, through the pulmonary circuit, back to the left side of the heart and out into the systemic circulation, right? So that's kind of absorption, right? Then we have, and there are lots of ways that we do administer drugs. We'll talk as well about intravenous administration, intramuscular. We might even talk about transdermal patches. And of course, drugs can be inhaled as well, depending on the drug. Distribution then is the transport of drug molecules to and from the blood to various tissues. And of course, it's at the tissue level where those drugs interact with cellular targets. When we go to the out phases, then the first one is metabolism. What is metabolism? It's conversion of a parent compound to a daughter compound. And it occurs predominantly via liver enzymes or hepatic enzymes. And we'll talk about the CYP450 enzymes. Although, metabolism does occur elsewhere, so outside of the liver, but to a much lesser extent. Now, very often when we start talking about metabolism, students will say, oh, the drug gets broken down in the liver, right? That's not necessarily true, because metabolism will often involve the addition of groups so that these daughter compounds are actually larger than the parent compound. So methyl groups or acetyl groups get added to form these daughter compounds. And that will increase the polarity of the drug metabolites, right? And when you increase the polarity, they're going to become more water soluble. And that's going to then facilitate better excretion from the body via urine, for example. So that's one thing that can happen. Remember as well, we talked about some drugs that are administered as a prodrug, so in an inactive form. And it's these liver enzymes here that will metabolize them into their active form. Okay, and we'll go through all of that as well. The final one then, of course, is excretion, which is the permanent removal of active drug or inactive drug metabolites from the body. Again, the most common way that drugs leave the body is through urine. So you're thinking of the renal system here. But of course, some drugs are actually excreted via the digestive tract through feces, and some drugs are exhaled, right? I want you to start even thinking at this early stage of, somebody who has kidney disease, right? And they are prescribed a drug that's excreted via urine. In that case, the excretion is going to be, less than what's intended, kind of thing. So those drugs will have a longer half-life in the body. And in that case, clinicians might actually change the class of drug that person is taken to a class of drug that is eliminated via the digestive tract.